Hello everyone, in this video I am going to talk to you about this anomaly which is known as Epstein anomaly, one of the cause of cyanotic heart disease. This can be further classified among the cyanotic heart diseases. It is one of the cyanotic heart disease in which pulmonary blood flow is decreased, and that is why there is cyanosis. Now I'll tell you what the problem with Epstein anomaly is. So normally we have tricuspid valve. The tricuspid valve, it opens during ventricular diastole, so that the blood from the right atria can go into the right ventricle, right? So that is something that normally happens. But in patients with Epstein anomaly, the tricuspid valve, the posterior and septal leaflets of the tricuspid valve, it prolapses. So if there is tricuspid valve prolapse, that means during right ventricular systole, the tricuspid valve, it cannot close. So what are the problems that happen? So the first problem that happens is there is regurgitation of blood back into the right atrium. So the first problem is tricuspid regurgitation, number one. Number two, what happens is the leaflet of tricuspid valve, it when there is ventricular systole, the blood pushes the prolapsed leaflet towards the pulmonary artery. So in ventricular systole or in right ventricular systole, or when the right ventricle contracts, blood from the right ventricle, it should go into the pulmonary artery. It should have gone into the pulmonary artery, but it cannot go into the pulmonary artery because the prolapsed valve, it creates a sort of a mechanical obstruction to the right ventricular outflow. So therefore this is known as right ventricular outflow obstruction. We've heard about left ventricular outflow obstruction in hypertrophic cardiomyopathy, hypertrophic obstructive cardiomyopathy. So one of the causes of right ventricular outflow obstruction is an Epstein anomaly. So because of tricuspid regurgitation, there is dilatation, massive dilatation of the right atria, and subsequently the right ventricle is also small. Why? Because all of the blood that comes into the ventricle, most of it is being regurgitated back into the atria itself. Another thing that this prolapse causes is something known as atrialization of right ventricle. That means when the blood flows from the right atrium to the right ventricle, much of the blood remains inside the prolapsed or within the prolapsed segment of the tricuspid valve itself. So that is known as atrialization of right ventricle. Okay, so these were the problems with Epstein anomaly. So because the pulmonary blood flow is being decreased, the patient will now experience cyanosis because the blood from the heart cannot go into the lungs. Subsequently, the blood coming into the left side of the heart would also be less in volume. So systemic circulation, systemic output would also be less, and proper oxygenation of blood would not have been there. So this patient would definitely be suffering from cyanosis. So this is a cyanotic heart disease where the blood supply to the heart is decreased. Now what would be an expected X-ray finding of this patient? When you do a chest X-ray, you can already see that the right atrium is very dilated. It is very much enlarged. Therefore, when you do a chest X-ray, you would see that the right atria is very enlarged, and it generally presents with right atrial enlargement. It generally presents with something known as splaying of trachea, and number two, double border sign. So because right atria is enlarged, you could trace the border of right atria as well as left atria. That is known as double border sign. And splaying of trachea is basically because, imagine this is your trachea, left side as well as right side. Left side is more horizontal, and right side is more vertical and it is broader, and left side is more horizontal and it is shorter and it is less broader, that is it is narrower. Here is the location of your right atrium. If it enlarges, it will cause further splaying of the two bronchi, two principal bronchi, right and left main bronchus, and this is what is seen in X-ray as a this is seen as splaying of trachea. Now, what would be a murmur that you would expect while auscultating the chest of this patient? Because this patient has a tricuspid regurgitation, the patient would have a pansystolic murmur, and you could also hear quadruple rhythm while auscultation. You would hear multiple heart sounds in this person. So generally, splaying of trachea and double border signs, these are general, these are expected findings in right atrial enlargement. But what we say characteristically in patients with Epstein anomaly is that the heart is so much enlarged that it appears as a box, and that is known as a box shaped heart. A boot shaped heart would be seen in tetralogy of Fallot. So please don't get confused between box shaped heart and a boot shaped heart. So there are certain diseases where you could see Epstein anomaly. Very classically, we see this anomaly with lithium exposure, intrauterine lithium exposure. Let's say a lady who has bipolar disorder, who had been taking lithium, got pregnant, she didn't know, and this baby also got intrauterine exposure of lithium. So this can cause Epstein anomaly. Another association of Epstein anomaly would be Wolff Parkinson White syndrome. I have already made a video on Wolff Parkinson White syndrome. If you want to learn about the ECG findings and the problems with Wolff Parkinson White syndrome, please go and check my channel. So this was a very short discussion on Epstein anomaly. In this video, I have explained to you what is the problem in Epstein anomaly, what are the diseases that are associated with this disorder, and what are the clinical as well as radiological findings of Epstein anomaly, and the reason why it produces cyanotic type of heart disease. Thank you so much for watching. Have a great day.